Okay, well, welcome everyone to the HealthLinks webinar series. I'm Kaylee Rivera. I am the Community Engagement and Trainings Manager for HealthLinks, and I'm very excited to have this webinar today to go over all of our exciting HealthLinks updates and share with you our national expansion and have some words from our director, Lily Tenney. So thanks for joining, and as usual, we are recording this. Lily, you can go ahead and advance to the next slide. So we typically have our webinar series try to touch on one of our HealthLinks benchmarks, which are the 6 benchmarks that comprise our HealthLinks standard and are the sections of which the assessment asks questions around. And since we're giving updates today on all programmatic efforts, it naturally touches on each one of these benchmarks. So these are our icons and just a quick refresher for you of our HealthLinks benchmarks. You can go ahead and move forward. Perfect. So the general housekeeping items, as you may have heard before, and I kind of just started to touch on, I am recording this webinar, so it will be posted to our YouTube page, as well as be sent out in a follow-up email, a link to the recording, and the slides will be available for you to download. So just keep that in mind. We will keep everybody on mute throughout the duration of the presentation, but I'll be monitoring the chat box. So please feel free to use the control panel on your screen, find the chat box, and type in any sort of questions that you have. And I believe that Lily has left time at the end as well to kind of take questions. So you can definitely chat them in along the way or wait till the end and see what sparks your mind then. And then at the end of the presentation, I actually didn't correct that last bullet, but a survey will be sent, and it's just going to be in the same email with the slides and the link to the presentation. And if you wouldn't mind rating the webinar, we always appreciate the feedback and always are looking to improve. And these lovely faces right here are our presenters today. So we have our director, Lily Tenney. She's the Associate Director for Outreach at the Center for Health, Work, and Environment, our parent center. And her work focuses on total worker health and public health practice. Lily is the co-founder and director of HealthLinks, and she speaks nationally about the importance that organizations and leaders can have on impacting communities and creating better, healthier jobs for a healthier workforce. She's passionate about integrating total worker health with business sustainability, helping develop impact goals, and planning for work, health, and corporate social responsibility. For fun, Lily seeks outdoor adventure on skis and by foot, good food, and happy coworkers. We're really excited to hear you today, Lily. We also have David Shapiro, who is our business relations professional with HealthLinks, and he consults with organizations in our healthy workplace network, and he shares resources and recommendations to help improve the health and safety of their workforce. And prior to joining us here at the center, David served as the business relations manager for Executives Partnering to Invest in Children, also known as EPIC. He's the founder of Mountain Dads, a fatherhood initiative in Summit County Government's Youth and Family Services Division, and a proud husband and father of 3. His hobbies include tennis, hiking, reading, and gardening. And then me, as you already heard, I'm the Community and Engagement Trainings Manager. And I won't go into much more, but for fun, I like to hike, snowboard, and play with my cat. So Lily, I'll let you take it away.
Thanks, Kaylee. Good afternoon, everyone. Thanks for joining us today. It's fun to see a lot of familiar faces on the call or on the webinar. I've been talking with many of you over the last few months about the tremendous effort that we've been putting forward as far as what new updates and improvements we've been making to HealthLinks as part of our effort to expand the program nationally. So we thought it was just the perfect timing to spend a little bit of time to give you those updates in person and to answer any questions that you have. The new site for HealthLinks went live just 2 weeks ago, so we've been in the process of getting feedback on it, but also continuing to experiment a bit with our new language. And so first and foremost, I just want to thank those of you that have contributed so much to the program over the last 6 years, and look forward to working with those of you in continuation, but also the new folks on the phone that we're working with through partnerships, but also through our participating Healthy Workplace Network. So as Kaylee mentioned, David Shapiro, our business relations professional, is on the phone, and he's also, I've invited him to chime in along the way. He's going to be speaking towards the latter part of the presentation. The goal for this webinar is to report on what new activities we've had in the works over the last 6 months, including the program highlights. We'll cover how to get started. David's going to talk about the advising experience, and then I'll wrap up with next steps and have enough time for Q&A at the end of the presentation. To recap who we are and to give some acknowledgments to the team behind HealthLinks, we are a group of researchers and total worker health professionals based at the Center for Health, Work, and Environment at the Colorado School of Public Health. So we are one of 6 national funded centers, centers of excellence for total worker health. We are also one of 18 education and research centers that is funded through the National Institute for Occupational Safety and Health. And back in 2013, we formed HealthLinks with the support of a philanthropic gift from Pinnacle Assurance, which is a state-based workers' comp provider here in Colorado, to become a program that could work with communities and partner with businesses to help them achieve total worker health and improve workplace health and safety. So in these 2 photos, you'll see that they capture a lot of those that are on our team, not all of them that are on our team, including the communications and marketing team that have worked with a lot of what I'm going to show you here today. And I just wanted to give a special shout out to Avery Artman, who's our communications and media manager, and has led significant efforts with our website improvements. So what have we been up to? The activities over the last 6 months started with a process that ongoing process that we have in place for evaluation around how the program itself is leading to a certain impact, but also the satisfaction that businesses and the organizations that we were working with were experiencing what we were offering as far as assessment and advising. So this led us to look at the data that we were collecting with various evaluation tools, including user surveys, through interviews with participating businesses. We had the opportunity to pilot in 2 states, including Florida and Oregon, with partners in Oregon, to look at some different models of how we were offering various components of the program, and what pieces were most valuable, what benefits businesses were relating most with. We then hired a marketing firm to conduct additional market research. So we were looking at who specifically are we talking to in organizations, who's our target audience, and what else is out there as far as the type of services that we're offering, and also the types of services that are available to all organizations, including small and mid-sized employers as well as the larger employers. And what we heard, and this is a snapshot of some of that information, and I just realized, I apologize, that the y-axis is cut off, so I'll walk you through this chart. But overall, we asked businesses in our network, why did they take the Health Links assessment? And for those of you that are familiar with Health Links, this is the starting point for us looking at what organizations are currently doing for health and safety policies and programs and organizational supports in their workplace. The majority of those responded that they took it to get recognized for their commitment to employee health and safety, followed by getting feedback on how to improve, to gain access to evidence-based tools and resources. Just over 60% indicated that they took the Health Links assessment to get access to advising and receive advising. Over 50% indicated that they wanted to be recognized as a leader in their community, so different from being recognized and certified for their commitment. They really wanted to showcase this recognition in their community. Over just about a quarter of those in our network said that they completed it to enroll in Swell, and that is a 5-year study that we have been funded to do in the state of Colorado with small businesses with less than 500 employees. And completing the Health Links assessment is the first step for participating in that study. So that doesn't come as a surprise. We also wanted to understand how organizations and if organizations did anything after completing the Health Links assessment. So this is a snapshot of those that completed the Health Links assessment, but also completed advising. And as you can see, nearly 90% of those organizations that completed the assessment indicated that they did make a change. So what kind of changes did they do? So we asked if they completed an advising session. It's encouraging to see that 80%, over 80% of those that have completed a Health Links assessment actually complete advising and have received advising. They are making changes, significant changes to increasing communications for promoting health and safety. They've increased conversation. They've presented feedback to leadership. And so those top 3 changes really indicate a level of change that's happening at the organizational support level after completing assessment. And so anecdotally, we have data to support that this is happening as far as the assessment being an educational tool for those businesses to really understand what strengths and weaknesses exist within their organization. But then we're also seeing some transactional changes happening as a result of the advising sessions and the Health Links assessment. So the 5th item down shows that 48% of the respondents have administered a needs assessment or an interest survey to employees. And that is our most common recommendation that is made under our workplace assessment benchmarks. They've started offering resources and activities to employee family members and dependents. They've started incentivizing employees to participate in health and safety activities. And so this is data from a survey that we did as a 6-month follow-up to those in our network, and we received about 72 responses from this, in addition to other data that we're collecting and analyzing as part of our program. So the second phase that led to these program improvements was for us to look at all of this and the lessons learned, and to make 4 significant fundamental changes to the program, which started with us updating our messaging. And since becoming a Total Worker Health Center, we recognized that we were really serving as an umbrella and a resource for identifying what businesses and organizations, or what organizations are doing. And that's one of the terminologies you hear me going back and forth between business and workplace and organization that we've really come to grips with, because we work with so many different types of organizations. So the new messaging that I'm going to present today was really built around what our mission is as a center of excellence for total worker health, and what our goals are for working with organizations to adopt and implement the best in science. The second one was for us to develop a tiered plan structure for offering more options. I heard from groups that they were wanting and needing a range of services, including different levels of access to tools, including trainings and other assessment tools. We also heard that they wanted more advising. So we wanted to develop out a plan structure that would give those options for different needs. The third one is a new website. It doesn't come as a surprise to any of us that technology changes so rapidly that it was time for us to keep up with a new user experience, user interface that allowed less clicks and a quicker call to action and process, technology platform that would get users to the assessment, to purchase a plan, to go through the assessment, and then to access a dashboard where they could reference this oldest their history assessments, and I'll give you a snapshot of that today. And then the last one is what we have done to develop out our outreach approach, including an ambassador program, a partner group that's comprised of national leaders in the space of total worker health and community and public health, and then our training program. The last phase that I wanted to highlight for you is for us to figure out how we can help change more organizations. And at the end of the day, that's what we're trying to support, is positive change that can impact and have positive impact on the lives of workers. And the three ways that we're doing this is to provide an online assessment, which has a new name. So we're calling that our Healthy Workplace Assessment, but the same questions. By offering advising, so we've done work to improve the Healthy Workplace Action Plan, but also the process of advising and the structure of which we're providing it. The third is modules. So we have built out, and we're currently building more for taking a deeper dive in areas such as family-friendly, an employee health and culture survey, cancer supports, the built environment, mental health, and what we're calling outdoor RX. And so this is a library that we have in the pipeline for offering additional assessment tools, report cards, and consulting in each of these areas. And then lastly, the trainings and access to an open access resource center. So now I'll switching gears, want to give you a preview. Hopefully you've received the communication and email announcing the new website, but to give you just more specifics as to the items that I just discussed, I'll go into specifically the messaging that we're working with, and that's showcased on the website. So first and foremost, and this is a statement about what we do, and the hope is that we're being straightforward and elevating the pieces that connect us back to being an evidence-based research center in this field and experts in the field of total worker health. So what we do is HealthLinks is a mentoring program that champions health and safety at work. We offer evidence-based healthy workplace certification and advising to help organizations and their team members achieve total worker health. Who are we? I've covered, but I'll repeat again. We are based at the Center for Health, Work, and Environment at the Colorado School of Public Health. Therefore, we operate as a nonprofit program within the university, using evidence-based strategies to help inform and improve workplace health and safety. The who is a big one, and this is one I'm proud to really evolve, to have seen evolve over the process of us updating the program. So the way in which we're speaking to organizations is very inclusive. So we state that whether your team works in an office, in a field, on a site, in their homes, or somewhere else, we can help you create a healthier and safer environment. Healthy Workplace certification is available to companies, private, nonprofit, government agencies, and all organizations operating in the United States. And so that led to the change in name from Healthy Business certification to Healthy Workplace certification to translate that inclusion criteria. Now let's get into how it works. The process is relatively the same, but has been significantly improved on the website and the user experience for how they get to each of these steps. So the first step is assessment, the second is advising, and the third is achievement, or what we call certification or recognition, in 4 levels. And I'll walk through those now. The assessment, as before, is an online assessment to benchmark efforts to date. So this is a snapshot of what organizations are currently doing across each of the 6 benchmarks. Those 6 benchmarks are scored and have certain criteria that need to be met in order to meet the standard for certification. So some things to note is that the assessment itself is an educational tool. We have seen organizations make changes just based on completing the assessment and receiving their report card. It is an online tool that businesses and organizations are able to start and come back to, but we've made improvements to be able to provide the questions up front so that those organizations know what type of data or information they need to have on hand before completing the assessment. The advising is completed virtually. This is one of the most significant changes that we've made to the program. We have piloted this, as I mentioned, through our work in Colorado and in Oregon to test the virtual model, and have received positive feedback about how it can, or how it's being offered in a way that is convenient to businesses. The organizations can decide when to schedule their advising sessions and what works best for them. And then after completing an advising session and having a conversation based on a certain set of questions and reviewing a report card, what our team does is develop a healthy workplace action plan that establishes those goals and recommendations and action steps. And that is used to track progress over time, but is also used as a product that these organizations can take back to their teams to implement certain policies and strategies in their workplace in each of the benchmarks. The achievement step is linked back to accessing these tools and trainings, and also around certification. So part of what we want to see as part of national expansion is to have the bandwidth, but also the capacity within these organizations so that they're able to have team members access trainings, but also the best tools and low-cost tools that other science-based and research institutions have access to. So we understand the importance of delivering evidence-based resources, but we also recognize the importance of having them be business-facing. So a lot of the work that we do is trying to translate those tools and resources into templates and trainings that are, again, very accessible to people that we know have competing priorities and are also not just prioritizing health and safety in their workplaces, but are looking for some plug and play resources that can be easy wins for them in the long haul. As far as the benefits for participating in HealthLinks overall, the top benefits that link back to a lot of the feedback and evaluation we've done are I'm highlighting 3 of them here today. So overall, the message that we're sending is that healthy, safe work environments support employee well-being and productivity. And just a few of those reasons include the assessment piece, so understanding progress and receiving recognition for this commitment. The second one is receiving this personal advising support. Not all businesses can afford to hire a consulting firm like Accenture or McKinsey, or even some of the vendor services out there. So we really wanted to be able to offer a level of consultation that was approachable to organizations of all shapes and sizes. And then lastly is the total worker health approach we're taking and the recognition of that at the national level being backed with institutions and government agencies such as the CDC and NIOSH, but also in the private sector, recognizing that it spans beyond safety, it spans beyond exposures in the workplace, and that we as a society and as a business community really need to start looking at a holistic approach to supporting and improving the lives and the health of all workers. So how do we get involved? How do we want organizations, including those of you on the phone, but also those of you that are working with the business community and different organizations? How do we get involved? How do they get involved? We're making it simple. So the first step is selecting a plan. If you go to healthlinkcertified.org and go to Get Started, you will be led to a snapshot of the 3 plans, including Basic, Plus, and Premium. They're priced on an annual subscription type model that includes access to a different level of resources, but also most significantly, a different level of advising. So all plans include the access to the assessment, and that's the starting step for organizations to get started once they've purchased a plan. And it really depends on what type of services and tools the organization is looking for. The number of advising sessions ranges from 1 to unlimited. So those that are paying $450 a year, regardless of how many employees they have, can receive unlimited advising sessions. So we challenge you as an organization to really take advantage of that and to be able to not just check in on the goals that you create as part of your Healthy Workplace Action Plan, but to also access some of these additional resources. I mentioned the Employee Health and Culture Survey that was developed by expert faculty at our center and in our department, and has been delivered as part of the SWELL study that we're conducting. It is one of a kind. It was built with validated measures, and recognizing that we're in a world of robust surveys and survey fatigue. What we're offering with the culture survey is something really unique in that you as an organization have access to administering this through a survey platform, receiving results, and then scheduling an advising session to review those results with your team, your leadership, to look at things like job satisfaction, meaningfulness of work, and compare it against your healthy workplace assessment results so that you can really start to understand the association between what you're doing as an organization and the perceptions of your employees. The second step is taking the assessment. So we've talked about that. It typically takes an organization roughly 30 minutes to complete. And one of the things I want to stress here is around the instructions and who should complete this assessment. We've made adjustments to and updates to the instructions to encourage that organizations really sit down with their health and safety team or people who are responsible for this in their organization to have a consensus around the answers. We want to have the most accurate information possible, and we have a chance to validate the information that is completed on the assessment through advising. So one of the things that we hope to see is that this assessment starts to really reflect not just accurate information, but is completed by a whole health and safety team or at least a couple of individuals within an organization. Kaylee mentioned the benchmarks. We're building out online training that covers each of these. But each of these benchmarks has a set of questions. As I mentioned, that scored, has criteria associated with it, to produce a report card that scores against each of the benchmarks. And then as a second page to this report card, so you can see where you fall as an organization, it starts to provide, or it provides recommendations for some of these, but it is a guide to leading to what we're calling an introductory consultation to review these results as your next step. So all organizations that complete the assessment are recognized at one of 4 levels, including Certified Healthy Workplace Leader, which is the top level, Certified Healthy Workplace Partner, and then Certified Healthy Workplace, and Kickstart Healthy Workplace, which is all of those, or which is the recognition level for all the organizations that are doing something, have completed the assessment, but don't yet meet the criteria for certification. This last step is to connect with an advisor. And connecting with the advisor has become significantly easier due to what we've set up with our virtual model and the improvements that we've implemented for things like auto scheduling. And at this point, I want to hand it off to David Shapiro, who is head of our business professional relations, and can walk you through the next few slides about advising. So David, take it away.
Thanks, Lily, and thanks for the comprehensive overview getting to this point. I'm excited to be part of the HealthLinks team and this Center for Health, Work, and Environment, all of the work we're doing with employers across industry, regardless of size. And the new model that we're rolling out is really accessible to individuals anywhere in North America. So I just want to talk briefly about advising, what that looks like, how easy it is to access, and what it entails. So the first step is how you go about scheduling your introductory consultation or advising session. So just to back up a moment, the introductory consultation happens after you've completed the Healthy Workplace assessment and received your certification. So you'll receive notices on your online dashboard as well as via email that say, great job completing your HealthLinks assessment, and it's time to schedule your introductory consultation. We use an online scheduling tool so that you can book your appointments at a time and a date that works best for you. So our calendar is open and available, usually about 3 or 4 months out. We are hoping that you pick your introductory consultation and even your first advising session within the first few weeks or month after completing the assessment, so the information is fresh on your mind, and we can give you a long runway for working on the goals ahead. So how you schedule the intro consults and the advising session is through an online scheduling tool. It's pretty easy to use. And then just want to touch briefly on what the introductory consultation is. A 15-minute appointment where you receive an overview of total worker health. It's where we get to know you briefly, and we get to provide you a snapshot around the benchmarks and what total worker health is. We get to go over your report card and a brief update on your online dashboard, things to look for, and how to use the HealthLinks resources that you've signed up for via your plan. After the 15-minute introductory consultation is completed, you'll get a link to schedule your first advising session. Advising sessions take about 45 minutes, and the number of advising sessions you receive is dependent on which plan you pick that Lily mentioned earlier. So that first advising session, everyone in every plan gets the introductory consultation and the first advising session. And that's a really important session because it's where we build the Healthy Workplace Action Plan for your year ahead. That action plan is based on your unique needs and interests, based on your industry, based on your size, and we use the evidence-based information that we have as part of the Center for Health, Work, and Environment to discuss total worker health in your industry, but it's also where we get feedback from you on what's important to you and your staff, your health and safety committees. And we tie your assessment results, the feedback from you during the advising session, and the information that we know based on being a center of excellence for total worker health, we combine all of that into 3 goals that make up your workplace action plan for the year ahead. Those goals are tied to specific action steps, recommendations, and resources that are specific to you based on your size and your industry. The resources are curated from our broader HealthLinks online resource center. And lastly, that action plan is also uploaded to your dashboard online. So it's part of all of the other tools that you have access to when you log into your HealthLinks portal. Lastly, how does advising happen? We use Zoom conferencing to schedule, once you've confirmed your appointment via the scheduling, we use Zoom conferencing to host the virtual advising sessions. And Zoom is really great because you can invite as many individuals as you'd like to participate in the appointment, and we can host these advising sessions for employers anywhere in the world, really. And so we really like this format in that you can have multiple people that you've invited to participate, and also we can help you no matter where you are. And so for organizations that pick the Plus or the Premium plan, obviously they have additional advising sessions where we can check in on goals. We will still email and send you trainings and events, updates throughout the year, no matter what plan you're in, prompting you to follow up on your goals. And through advising, when there are multiple sessions, we'll be able to check in with you during multiple 45-minute appointments to track your progress on your goals, and also just to get feedback from you on how things are going. So the last thing I want to talk about is a success story from a new certified employer, the City of Longmont. So City of Longmont is a large employer. They have 900 or so employees between full and part-time, and another 700 that are contract or seasonal workers. And they are certified at the leader level, having taken the assessment for the first time in June of 2018. What I like about the story from City of Longmont is they have really embraced total worker health. They have a very strong foundation in safety, and they've built a lot of the health and well-being programming into their risk assessment or their risk management department. And that integration of health and well-being as part of the safety committee and the safety effort really has led to strong communication and better engagement for all staff in total worker health. It's something that everyone at City of Longmont takes very seriously. And as you probably are aware of, but you can certainly find out more about from our website or in talking with us, it's that integration of health and safety that really is the foundation of total worker health. And they do a host of things to support their employees, but their vision for total worker health is to continue to expand on their success and their foundation in safety in order to have even more engagement and better policies and benefits for their staff. And the three things that we worked on for 2018 were championing family-friendly workplace policies and practices. So City of Longmont is taking a deeper dive on supporting employees as caregivers and finding out what that means based on their sector and their staff. And then we also talked about how to integrate mental health into the health and safety activities that they are already engaging in. So, and lastly, the third thing we talked about kind of ties in both of those first two goals is just managing stress among employees in general. And so when we come up with goals like the three that I just mentioned, each one will be tied to specific action steps, recommendations, and evidence-based resources that would help you and your team carry out the goals in the year ahead. So look forward to working with any of you that are on the call, and certainly available for additional questions at the end of this session or at any point.
Thank you, David. So wrapping up here before we open up for Q&A, I wanted to give a very brief high-level overview of what the next steps are for national expansion. So with this new website launch, it gives us the capability to be able to work and service organizations across the country. And our goal is in this next year to be able to really effectively enter some new markets with the help of local partners, and a launch plan that includes partner and ambassador engagement. So Kaylee is heading up our ambassador program and has been recruiting individuals, but also partner organizations to join that team and provide them with resources that help them offer HealthLinks as a resource in their community to organizations. And so this includes partnerships with groups such as United Way down in Texas, where they are working on early childhood initiatives and engagement with employers. And so in part, we're partnered with them to be able to offer HealthLinks as an assessment tool and access to our family-friendly module to be able to engage with that employer group and start looking at what employers are doing for parental leave policies and also caregiving practices in their organization. So that's just one example of how we're working with some community partners. We're also going to be implementing a digital marketing plan that includes leveraging platforms, social media platforms on LinkedIn and Facebook, also working on some paid advertising to reach our target audience, and that includes decision makers in organizations, so executives, owners, and executives in companies, as well as the HR professionals and health and safety professionals. So those that are responsible for total worker health activities in their organizations. And then continuing our local engagement. We've got a great track record in the state of Colorado where we've been able to test a lot of the outreach that happens through chambers of commerce, economic development, workforce groups, and government and public health to reach businesses and connect the total worker health message with a lot of the community health and public health initiatives and goals that are happening. So that will continue and also expand through these partnerships that we're implementing in new states. And then over the course of this time, we'll be conducting ongoing evaluation to really look at what's working, what's not, how we can continue to improve. So this is a call to you all to go and help us not just spread the word, but also provide feedback on what we've presented here today. So a lot of this information is similar to what you may have heard before, but I want to highlight what is different and just recap that for you as far as the changes that have been made to deliver this not only to our existing business network of about 500 or just over 500 organizations that have participated in HealthLinks over the last 5 years, but in reaching new organizations to help them and provide them with solutions that will truly help impact the health and safety of their workforce. So to highlight what has changed programmatically is to reference the website first and foremost. The messaging elevates the total worker health message and the association to who we are and the backbone of the approach that we're taking. The user experience includes changes that have organizations select one of 3 plans, invest in terms of making a payment to give them access to the assessment and the tools that is based on the plan that they select. The other change is the dashboard. So once you've registered, you've picked a plan and paid for a plan, you have access to your dashboard, which highlights your assessments, your results, and your tools that you have access to, and to highlight some of what new features are available through your dashboard and through these plans. The biggest one is the access to additional assessment tools, additional advising, and then additional training that the Plus and Premium plans have access to. So with that, I want to leave time, the last 10 minutes, for any questions that folks on the phone have before we wrap up for the day. So Kaylee, I'll let you take over as far as managing the instructions for the chat function.
Perfect. I don't see any coming in at the moment, but while people are perhaps typing in, I'll just highlight that I've been with HealthLinks a little over 2 years now and kind of seen some different involvements, and I think by far what we've done with this new website and the new way we're doing advising is one of the most exciting things that's happened, and we're really making progress to meet the organization's needs, and we take in all your feedback, so it's always welcome, and we love hearing from all of you. And I see that, Sabrina, just to answer your quick question, there were about 20 people on the call today. And I would encourage everyone, if you are already certified, definitely check out the dashboard. It has some cool stuff. You can find the links to our online trainings. We sent out an email yesterday about those new courses, and we're continuing to develop out more. So definitely give those a quick look and see if you're interested in taking them. They range from about 30 minutes to an hour, depending which course you decide to take. Well, I'm not seeing any questions come through. If you want to advance to the next slide, I'll just go through some of the updates that I have, and then people can continue to type in your questions, and I'm happy to read them if they come in. So this is just a recap. If you aren't certified, but you want to be, and you got really excited listening to today's presentation, or you know someone who should go through HealthLinks, feel free to contact us. You can use the contact email that we have. We are always, available to chat about this and help you learn more, send any sort of information you need. And then just a quick plug, if you're in Colorado and you are an organization with 500 employees or less, I'd encourage you to check out this Small Safe Well study. It uses HealthLinks as an intervention tool within businesses, as well as some extra components like their culture survey and total worker health leadership training, which are awesome added benefits that they are using in the study. And if you'd like more information around joining that study and helping us, contribute to science, as well as getting your organization some really tangible tools and resources, definitely check out the site listed there or contact myself and I can put you in touch with the right folks. And lastly, all of you are probably super excited about HealthLinks, just like I am. So if you want to join the ambassador team, please join us. We have now about 30 people who are part of the group, and we are doing our best to reach as many people as we can all across the country, because we want to improve the lives of all workers everywhere. So check out the short application there or email me directly. Happy to tell you more about what the mission is behind that and why we're so excited to kind of spread the word about how HealthLinks can come and be a resource for organizations. If you want to skip to the next one, Lily, I think it just has our next, I took out the other one, apologize, but we have one more webinar this year. Oh, never mind, there it is, thank you. It's going to be on diabetes prevention in the workplace, and that's December 12th. Before I send out these slides, I'll hyperlink that to the registration page, but you can also please join our newsletter. That's where you'll get the most up-to-date information, the links to sign up for different activities or trainings or webinars. So I encourage each and every one of you to do that. And follow us on social media. We just kind of launched our LinkedIn page a couple months back, and it's awesome. I think it's been my favorite stuff to see so far that we're promoting on social media. So check us out and help us share all of your stories as well. So tag us and we'll tag you back. Thanks for joining the call, everyone. I will be sending out the slides, and make sure to get all of you a copy of the slides as well as this recorded presentation. So enjoy the rest of your Wednesday, and we'll see you later. Oh, I'm sorry. I see one question. Maggie, if you are still on the line, to be an ambassador, and it's great you're outside of Colorado, or if that's somebody else that you're referencing, if you click on the link when I send these slides out, it'll take you to a short application, or you can just email me directly. There's no difference of the process for signing up if you're inside or outside of Colorado, and we can chat more about that, but it's just a couple questions, your name, your info, where do you currently reside, and kind of just us getting to know you, and then I can get you the next steps on being an ambassador. We have a really cool toolkit that we put together too that has really helped people spread the word and have the resources at the tip of their fingers.
Thank you all for joining. Have a great day.